your sexual preference have any impact on whether or not you are a safe blood donor? The National AIDS Control Organization certainly thinks so. The country's nodal AIDS control body replied yes to an RTI application which asked if the LGBTQ community is a high-risk group not allowed to donate blood. The response by the country's nodal body for AIDS control has sparked a massive debate on discrimination.
Even if not a sexuality, religion, caste or any sort of identity would be a criteria for blood donation rather than the medical fitness, medical condition of any individual. It's ridiculous, it's laughable.
Mirror Now also confronted NACO, and while they distanced themselves from the controversy, nevertheless they reiterated that the LGBTQ community are categorized as high-risk donors.
हम जहां इतने सालों से लड़ रहे हैं सेक्शन 377 को लेट डाउन करने के लिए, हम जहां लड़ रहे हैं कि टीजी बिल पास हो जाए और टीजी राइट्स आ जाए, डिस्क्रिमिनेशन और स्टिग्मा को कम करने की बात कर रहे हैं एज अ एक्टिविस्ट ऑफ LGBT community per se.
They are treated as high risk group. By appearance also we can see the patient is a high risk group. But after good counseling.
NACO's response has LGBTQ activists and blood donation evangelists up in arms.
तो काउंसलिंग में उसको अगर समझ में आया कि ही इज़ हाई रिस्क बिहेवियर, उसके ही इज़ हैविंग हाई रिस्क बिहेवियर, तो तभी हम उनको कहते कि आप डोनेट नहीं करो या उसको अलग रीजन से डिप्लॉय करते हैं.
India also believes that safe blood is key. The donor's sexual preference does not matter.
LGBT के जो भी डोनर हैं वो अगर ब्लड डोनेट करना चाहते हैं तो बेशक कर सकते हैं.
सब लोगों में अवेयरनेस करना चाहिए. सिर्फ एक किसी कम्युनिटी को आप बंद करके तो ये गलत होगा, क्योंकि हमारे जैसे थेल पेरेंट्स जो है जिनके बच्चों को हर 10 दिन 12 दिन 15 दिन में लाइफ टाइम ब्लड चढ़ना है, उनके लिए ब्लड की बहुत शॉर्टेज हो रही है.
In a country where regular blood donors are still few in number and blood banks often face shortage of blood, on the urban debate we ask, should sexual preference be a criteria for donating blood? Is the LGBTQ community being unfairly singled out? Mirror Now report.
Well, it's a simple question we're asking this evening on the urban debate. If the key nodal office for the control of HIV/AIDS in the country puts out a message saying that the LGBT community or gay people, specifically homosexual men, are a high-risk group, are they increasing discrimination? Will there be even more people in our country now who don't want to live next to these people, who don't want to have them in their offices, who don't want to have them in their schools and their colleges, because now everyone will believe that they're high risk? Or is there some sort of medical, scientific, tested out theory, proven theory, that these people should not donate blood? Should we be more responsible in these offices while making these statements? That's the question we're asking this evening, and as always, our phone lines are open. Joining me on the show, Shaina NC, national spokesperson of the BJP. We're grateful to have her as part of this conversation. Dr. Farah Ingale is the senior internal medicine specialist at the Hiranandani Hospital. Anjali Gopalan is the founder of NAZ Foundation. Dr. Ravi Malik is the CMD at Radix Hospital. Deepak Kashyap is a clinical psychologist and a gay rights activist. C. Sachin Avasthi is transgender. He's also program officer for the network of Maharashtra for people living with HIV/AIDS, specifically for a program called Vihan. And Sushant will also join us through the course of the conversation. He's an LGBT activist. We're also very happy to have Dr. Sanjeev Mehta, pulmonologist at Leelavati Hospital, who joins us as well. I welcome all of you to this conversation. I'm going to start with the medical experts here. I'll start with Dr. Ingale. Do you believe that there is such a thing as high risk specifically to do with homosexual men? And was NACO, the National AIDS Control Organization, right by putting out this information?
Yeah. In the very beginning, I would like to be very clear that we as practicing doctors do not differentiate individuals on the basis of sex, religion or socio-economic status. We take an individual as an individual patient and treat them equally. Now, as far as this the community is concerned, these people are supposed to be at high risk for transmitting infections, whether it is through parental routes or through blood donations. Now, the community has higher incidences of sexually transmitted as well as blood donation transmitted infections like HIV, hepatitis B, hepatitis C, syphilis, and many other infections. So that is why the American Red Cross, and even here in India, we follow strict norms while screening the individuals, because we don't want either the donor or the recipient to be at risk of acquiring new infections through blood transfusions. These people are definitely at high risk of transmitting the infections through blood transfusions.
Well, Dr. Ingali, tell us what you mean when you say careful screening. You said we screen carefully to make sure that there aren't any high-risk donors. What does screening carefully entail?
No, see, before we transfuse the blood, we check for various diseases, like we test for HIV, we test for hepatitis B, we test for hepatitis C, we test for VDRL and many other illnesses which can be transmitted through blood transfusions. Now, because of the recent advances in the number of tests which are available these days, more and more sophisticated tests are available, because of which we are able to detect many diseases at an earlier stage and more accurately. But still, all the tests which are available are not 100% accurate. They are not 100% sensitive and specific. So in spite of screening the individual for these various problems, there is a risk of transmitting these diseases to the recipient. Like, there is an entity called incubation period or window period, where the bacteria or the virus has already entered your body, but your body does not manifest the symptoms and signs. In this period, if you transfuse the blood products, the test at that time may come negative, but the patient or the recipient may develop the illness later on. Now, the incubation period for HIV, to say, may be anywhere for up to 14 days, or it can get extended up to 3 months to 6 months. But then in certain individuals, it may not be tested positive, and the test can come positive even after 6 months, which accounts to about 3% of the patients. So there is still a probability of transmitting HIV infection in spite of thorough screening of the individual to an extent of 3%. It is 3%, that is the number, but then for the person who receives the blood, if he gets the infection, if he acquires HIV, it is going to be 100% for him.
Right.
That
so
is the reason.
I'm given to understand that the cases of
because of one is
right. I'm given to understand that the probability of someone contracting HIV/AIDS through blood transfusion is 1 in 2 million. I want to bring in Anjali Gopalan here. Anjali Gopalan, founder of NAS Foundation. Do you believe that this is discriminatory, or do you believe that it's just prudent medical sense? Right, we seem to have lost our connection with Anjali. We'll try and get her back there. But in the meantime, Deepak, where do you stand?
Well, I think that it's definitely prudent medically in some ways, and also archaic scientifically in some ways. These bans were placed during 1980s, when we had absolutely no knowledge of what is HIV. Is it even a virus? Is it a bacteria? What is it? And until 1985, we had no test to even know it. So up until 1984, everybody had completely banned men who have sex with men to donate blood. But now, fast forward 30, 40 years now we have tests, now we have screenings, now we have everything to know whether the blood that is being donated is positive or not. However, I do agree with the doctor that there is an incubation period. So what we can do is we can reduce the deferral periods, because if you're going to just say gay men or men who have sex with men are not allowed to donate blood, essentially you're also talking about the identities of the people that are involved. It's not the identity, it's the behavior. Any woman, any man, any trans person, any gender non-binary person, whoever's having a risky sexual behavior should be screened. regardless of the fact
So
that
it's not specific to
it shouldn't be
the
identity
LGBT
specific.
community.
It should be
Yes.
behavior specific.
Right. I know Shaina Ansi wants to come in. Shaina, this is obviously a government body that has put out the information in reply to an RTI, where they have said, yes, they are high risk, and high risk should not be allowed to donate blood. Fundamentally, aren't we discriminating? Won't this undo all of the good work done by the Chune Se Nahi Phailta campaign?
First, let me please say.
Yes, go ahead.
No. Faye, please let me first on the outset say that every time you or any of your panelists refers to these people, who are these people? This is so derogatory. Now, for a government, our role is only to ensure that people are safe and secure. And we should actually leave it to medical experts, people who know the medical fraternity, to realize who are high-risk individuals and who are not. Today, you may take blood from a pregnant mother who has contracted HIV. Are we going to suggest that she should be donating? Absolutely not. Likewise, if there are certain cases of a particular community, I would like to term it as a community, because I truly believe that in the 21st century, we need to do away with archaic laws, and especially regressive laws of the 18th century that talk about criminalization of homosexuality or the lesbian community or transgenders. We need to move beyond that. That is one aspect of the debate, and why I'm highlighting this is it tells you where we're coming from. So do we need to be inclusive? Yes, we need to be inclusive. Do we need to be accepting? Yes. Do we need to move with times? Yes. But when it comes to the health of an individual, and when it comes to the clinical position of somebody who is procuring blood, if there are high-risk individuals who belong to any community or any segment of society, I would not term them as these people, because we need to treat them with the same respect as we treat any other man, woman, or transgender for that matter. We need to treat them with the same kind of acceptability, irrespective of what our ideology, ethos, and religious belief is. But I think the larger point is this, that if there is a donation of blood being given to a patient who is not in the know, or who is anyway in a high risk, why put that patient in a higher risk than that? Leave it to the medical experts, leave it to the health department to do what they think is best. And if science does come up with some kind of great technology to believe that yes, it is fine for even homosexuals and people from other varied backgrounds to donate blood, I'm sure that in the days to come the government will be accepting. But right now the government is not here sitting on judgment on a community or an act. The government is only talking about security and safety of a patient, and especially a high-risk patient who is getting a donor blood, which could be high risk as well.
And
so I think that
couldn't
puts
agree.
the whole debate
I
into
could not
perspective,
agree more
after
with
which
you.
You're welcome to take legal opinion and medical opinion.
I could not agree more with you. I think you nailed it on the head. Thank you for saying all the things that you did. Regarding all of this, there's a very, very important study that came out in 2001 in Italy, and it highlighted one point, and one point alone. It's called individual risk assessment.
Okay, what does that mean?
Yeah. Individual risk assessment means what Shaina was referring to is concentrating on the behavior of an individual. Post blood collection, pre-blood collection, and all sorts of questionnaires being given to them. And, I mean, till today, even if you're taking blood from someone, you have to test it for Blue Nile virus, you have to test it for syphilis, you have to test it for HIV, you have to test. What we need is to increase the infrastructure around blood collection.
Yes.
What we need is the infrastructure around blood testing. We don't need to have language that, as she said, criminalizes and demonizes a particular community. We need so much more blood today than we've ever needed.
There's definitely a shortage. I want to bring in Anjali Gopalan. We understand she can hear us now. Anjali Gopalan is the founder of the NAS Foundation. Anjali Gopalan, where do you stand on all of this? Is it the same question? Is it just prudent medicine, or are we discriminating?
I think we're discriminating, because if we even think about it logically, these tests have to be done, right? A number of tests have to be done on the blood sample. Now tell me something, in this country where 87% of infections are through the heterosexual route of transmission. So if blood is being taken, why are we only saying that homosexuals should be barred? Where is the logic in this? It's not seeming very logical to me. Now the point is, of course, do a risk assessment. Please find out the blood sample that you're getting is an okay sample. But please understand there are also tests which the government of India is not doing today. For example, a PCR can be done. Why is that not done? And anyway, whether you like it or not, you are, by saying it is homosexuals who are transmitting the infection, that you do not want to take blood from them. The role of the government of India, they have to ensure that the blood sample that is taken is tested, period. So if a heterosexual person is giving blood, you're going to test it. That blood may be infected. It may be in the window period. It may be in the window period. So it's the same as homosexuals. And if heterosexual transmission is so high in this country, are you trying to tell me that it's only homosexuals that you should be targeting?
Right. So I'll allow Shaina to respond to that. And my question remains the same thing. Shouldn't we be testing all blood, irrespective of the source?
What is the role of the government of India?
Of course.
Absolutely.
The role of the government
of Faye, what is the role of the government of India? The role of the government is not to be judgmental. We are not here sitting on judgment of two consenting adults irrespective of their sexual choices. We are here to only ensure there is safety and security of a patient. And especially if there are cases where high risk is brought to notice for reasons known to the medical fraternity, then the medical fraternity should take that decision. It is not the job of the government to sit on judgment. We are not sitting on judgment.
But I just want to point out, Shaina NC is a forward-thinking member of the ruling party. One second. Shaina NC is a very forward-thinking member of the ruling party who has given us her views at the top of the show. And she's very right. We agree with her wholeheartedly. But what happens when we have rules like this? Take, for example, this member, the Joint Secretary of the BTSC-ST, who said, we can tell by appearance if the person is high risk or not. Now, if that is not I can play that out for you. Do we have that? Can we play that out? So here's the fundamental question, right? Somebody walks into a blood bank to donate blood. You have someone sitting there who has been authorized to tell high risk and not high risk. How are they going to tell high risk and not high risk? How is this going to play out in a blood bank? This is how it's going to play out. We just play that. And they keep saying we're not discriminating. But we can look and we can tell whether this person is high risk or not. And this is fundamentally what it boils down to.
We are not doing any discrimination and stigmatized to that community. They are treated as high risk group. By appearance also we can see the patient is a high risk group. But after good counseling, for our all blood banks, we are instructed that after your counseling, pre-counseling, then you decide whether the blood is taken or not. High risk, previously I told that there are types of high risk. IDU is also one of that he is not doing the behavior of sex, but he is giving the injection, through injection the HIV can go, hepatitis can go, baki rest of the diseases also can appear.
लेकिन एट द टाइम ऑफ डोनेशन हमारा जो काउंसलर रहता है हर एक ब्लड बैंक में, वो काउंसलिंग करता है बंदे को, और जो काउंसलिंग में उसको अगर समझ में आया कि ही इज़ हाई रिस्क बिहेवियर, उसके ही इज़ हैविंग हाई रिस्क बिहेवियर, तो तभी हम उनको कहते कि आप डोनेट नहीं करो या उसको अलग रीज़न से डिप्लॉय करते हैं ब्लड डोनेशन करने से। ऐसा नहीं कि हम किसी भी कम्युनिटी को डिस्क्रिमिनेट करते हैं कि आप डोनेशन मत करो।
All right, so this is, and this is what it boils down to. They might be great medical professionals writing these policies, and just for our viewers' benefit, I'll tell you what the policy is. The National Blood Policy says take blood from any donor who's healthy and weighs a minimum of 50 kilos. The National AIDS Control Program, on the other hand, talks about high-risk groups who should be counselled rigorously before they are allowed to donate. Now you've heard, how do these people tell who should be counselled and who shouldn't be counselled? By appearance. If that is not the fundamental definition of discrimination, I don't know what is.
That is very much.
Sachin, go ahead.
Very frankly speaking, when I spoke to the people on the blood bank, few of the blood banks, I've clearly said, if I come out, I'm coming to you for a blood donation, and I'm open and out about my sexuality and my gender appearance per se. So, what do you think? That if you are open and out, we will definitely not go for even screening of you. We will ask you, no, we will not
you will
get
leave
it.
immediately.
We will leave, you have to ask to leave immediately. But I can tell you one of my incident. When I was in Banaras, I had given my blood to an accident case, and I have been clearly got a medical checkup done, plus a pre-counseling done, and my blood test was done at the time of getting its 1 day prior the donation. When we are talking about the government role, here I would like to say government role is definitely prior donation, definitely you are giving the questionnaire or a risk behavior and a blood test done. But it should be made mandatory that whenever the blood is being whenever the blood is being given to the patient, even that time the same test have to be done. Most of the case, what happened when talking about, doctor had mentioned of the incubation period or the window period. Of course, there may be the window period, but then at the time of donation, when a time the transmission is being taken place, at that time, if this has been noted on that it is disease-free blood, no one get a recheck of this blood again. So once the blood check has been done again at the time of transfusion, then it will help us to take care of the window period also.
Two more voices. Let me just bring in Dr. Ravi Malik, CMD of Radix Hospital. Dr. Malik, where do you stand on this question? And I just want you to focus on what these two individuals told us, and these are representatives of the state, blood authority, and they said, we can tell, we've instructed blood banks to be able to tell from appearance whether someone is high risk.
I don't agree with this thing. I think instead of categorizing whether this patient, making two categories based upon the personal sexual history, we cannot discriminate. What I mean to say you is that we need to see whether the patient is fit to donate or not as per with the best medical tests available. Now, as far as the window period is concerned, that stands true for even heterosexual behaviors, and there are so many things onto it. We have to larger picture, and we have to do a kind of involving the medical professionals, because every day we are needing thousands of units of blood, and there is paucity of this blood. So now if we are categorizing and we are excluding out a certain group, then how much impact it is making on the total collection of the units of the blood, because we might be losing, a lot of people might be losing.
Dr. Sanjeev Mehta of Leelavati Hospital, where do you stand? What is your medical opinion?
Yeah, Faith, thank you for calling me. I would like to take this discussion at a little different level. I think the first thing that the people should be made aware of is that blood testing, for the most part, as far as I'm aware, in India is done on antibodies, not on the antigen, which is nucleic acid testing.
Yeah, which is why we need the PCR.
I think whether it is homosexual, heterosexual, or any sexuality, there is a window period which puts all of us at a risk. That's point number one. Point number two, I think we should get this debate a little more scientific and less emotional. We need to know Indian data before we start categorizing anybody. I am not aware of Indian data as to the percentage of sexually transmitted diseases. Much of the information that we have today is based on old international, mainly American data, which had said that there is more prevalence of sexually transmitted diseases in people who have same-sex relationships. Now, there's another thing that I would like you to keep in mind. We should ask our most important stakeholder in all of this, the person whose life I'm going to save. That person is the recipient, and ask him what level of safeties that person wants. The last thing is, let's keep discrimination out of all of this. See, I do pre-medical testing for patients who are going to work, people are going to be my friends. at no level there is any discrimination. I think discrimination should never be there. It is the worst thing. We are in a democracy. We are in the 21st century. There is no question about discrimination. This should never be. But between us, I think we should move this to a more scientific plane of discussion and not be more emotional about all of this. That's where I stand.
Sachin, Dr. Mehta mentioned, Indian data. Since you work with the program, the Network of Maharashtra for People Living with HIV/AIDS, what is the data that's available to us right now?
Currently, total in national level per se, 2,15,000 are the positive people, and definitely within the national program decategorize the high-risk behavior and which falls the LGBT community per se one. Second would be the female sex worker, the IDUs and truckers. So this is what has been government policy or the government program, national program we're talking about. But instead of in data per se, Dr. Mehta words, I go with it. But then it's not about only the data per se. It's of course with the emotions also, because discrimination and stigma will increase and it will make more people go backward or into the hidden into the community per se. Today, there are very few people who are out and bold and open about their sexuality or the gender. But if such thing happening, there will be no new cases or no one more people will be coming out and talking about themselves.
We're not encouraging people to talk about their sexuality.
I also think that we are not assessing the risks. We are also not assessing the risks of taking enough blood. The number of people dying without lack of blood.
Yes.
As one of the doctors mentioned, there's paucity of blood. In a country like ours, where blood is needed by one person every 2 seconds.
What are we achieving by turning people away without testing them?
You just have to increase the infrastructure around blood collection, and you also have to increase a lot of sex education. Nobody's talking about education and awareness. Of course, that's such an important task. And the last thing that we have to do is individual risk assessment. When the world is following individual risk assessment, why are we lacking behind? We need to.
May I come into the
yes,
just a
go
little
ahead.
bit?
Go ahead,
I'm
Dr.
sorry, I'm on Skype, so I'm not able to see everybody. But let me ask this question: has anybody asked the stakeholder what level of safety the person wants?
That's actually impossible to do that.
I'm not saying that you should be in any way discriminating. If I was to tell you that I am willing that if a blood bank, just let's take a hypothetical situation and do a survey tomorrow.
It's not possible.
It's irrelevant and impossible. You never ask a patient before giving him. You never ask a patient's advice before you give him medicine.
Everyone wants the maximum security.
Ask the recipients. And you'll know tomorrow. The debate will.
No, but Dr. Mehta, I mean, how are we going to ask this question? Are we going to say, do you want the safest possible blood?
Do you want a gay man's blood?
Or do you want a gay man's blood? That sounds like an even scarier thing to do than the conversation we were already having. Because, I mean.
Or we start labeling the blood.
It's come from a gay man. It's come from a trans person. It's just.
So which person is going to say they don't want the safest blood?
Yeah, I mean, I would want my mother to have a safest blood if she needs, should she need it.
Of course.
And I'm going back to Anjali. So fundamentally, so here's the question I'm asking, right? If we ask any potential donor, have you had a sexual interaction without protection over the last 3 months?
Yes.
Yes means you cannot donate. No means, come on, we'll donate, we'll get it tested. Won't that work?
I think that's better.
Listen, I'm telling you, if we think about it practically, most people don't want to talk about their sexual exploits, period. So whether we like it or not, we must look at how we are doing the testing. We must start looking at doing a PCR test which is available, which looks at the virus itself. It's not looking at antibodies. Right. Of course, it's a lot more expensive, right? And a lot more difficult to run. But it is there. It is there today in the Indian markets. It's there. It is being used. It is being done. Whether we like it or not, this rule that they have is discriminating against a community. You tell me, is it making sense to anyone here who's listening to this that it's not a group, It is your behavior that puts you at risk.
Yes.
So if you're a heterosexual person who is indulging in risky behavior, you are equally, I think you're on the same platform as gay people.
Anjali's
it's not a question of the community you belong to.
Correct. Anjali's raised a very important cultural point, is that we are a country which loves to have sex but not talk about it. I mean, you don't get to be the second most populous country in the world without having sex.
I think
and that doesn't happen because of MSM.
I absolutely agree.
Or homosexual sex.
Straight people having more sex than us.
Yes.
Right. Okay. So let me just bring in some voices.
I think we should depend more upon the medical test.
Absolutely.
Yes.
I think we should depend upon more
PCR
upon the medical test, the medical counseling, rather than upon the disclosure of the personal sexual behavior.
Right.
Exactly. Both. We could do both.
We need better testing. We need better testing.
Better testing. And you know, Anjali is absolutely right. People tend to lie. Even if you gave someone a form and asked them to disclose sexual behavior, people are going to lie on that form. You're going to have to test
Which one of us talks honestly about it? Which one of us on this panel will talk honestly about our sexual exploits?
All right, okay, we have a couple of people in the studio, but we're not going there. Jayashri is on the phone line. Jayashri Bakshi is on the phone line from Pune. Our phone lines are open. Jayashri, go ahead.
Good evening, Tay. After a long time, I'm giving you a comment. Well, first of all, I would like to say that instead of discriminating, we need to have a high level of screening and accuracy in collecting blood, screening it, and then sending it. We have a window and incubation period, right? But instead of telling the community, then we should have a research-based program where you identify the LGBT, take a particular period and do the research and prove it that they are a high-risk community. We have IV drug users. Many of us will not say that we went to a gigolo or a commercial sex worker.
Right. So nobody's going to, it's the same point, nobody's going to disclose anything. You're going to have to test the blood irrespective of the donor, and you must test the blood irrespective of the donor and rely only on the science of the test. Nitesh on the phone line from Mumbai. Nitesh, go ahead.
Hello?
Yes, Nitesh.
Yes. In case you had any doubts, it has been confirmed yet again that we are the champions of discrimination. We discriminate on the basis of region, religion, caste, sex, food habits, and so much more. And if all that wasn't regressive enough, it has come to light that we have been discriminating against the LGBT community by not allowing them to donate blood. The LGBT community is already deprived of their basic moral and legal rights in our country. On top of that, banning them from donating blood is plain insulting. Everybody is at high risk. The blood given to any laboratory needs to be tested. If a straight person donates blood, it is offered to a beneficiary without testing. What's the point in declaring an entire community as high risk? Don't the
Yes. Why are we discriminating? I'm going to go back to Dr. Farah Ingale. Dr. Ingale, here's the question, and this is the thing that worries me when we read the story, this particular story in the newspaper, and after that, we'll have, first of all, we don't have enough education in our country about other forms of other choices in sexuality. We are going to then wind up with a system where neighbors are going to turn around and say, isko shayad AIDS bhi hoga. And that is scary. Because A, we are not talking about it, we're not educating people, we're not bringing more and more people into the realm of understanding what's really going on, and we're just going to confuse everybody further.
Yeah. Actually, with due respect to the LGBT community, as such as we doctors never differentiate or discriminate between different communities, as I've already made it clear. And it's not only the LGBT community, there are many other people who are not allowed to donate blood for medical reasons. Like suppose if you have undergone major surgery or you have undergone serious illness in the recent past, you had been suffering from any major illness, if you're pregnant, or even those who does permanent actually acupunctures, tattoos, and all those people are also for a certain period of time not allowed to donate blood. So it is not only the LGBT community, but then because the risk of transmission is high, I agree with all the discussions going on over here that we need to do proper counseling. Counseling is very important because I agree that it's not only homosexuals, it's also heterosexuals. If you have more than one sexual partner and the number of partners, the more the number of partners, more is the incidence of transmission. And we should definitely screen those people. Even heterosexuals transmit these problems more, or I can say more than homosexual. If a homosexual has only one partner, or if the homosexual is properly following the sexual method, if there is only one partner for a homosexual or he's taking all the precautions, then the chances of transmitting the disease to this homosexual is less compared to that heterosexual who has more than one partner. So the more the number of partners, the number of problems are more, and the acquired.
No, I don't understand. But multiple partners for anybody would be a risk.
That's
why we are not discriminating, but we need.
That's what you said. That's what you say.
All right, so multiple partners, for instance. So let me just come back to these regressive rules that have been put out by, the National AIDS Control Organization that says this entire community is high risk, and as a result, we have people in blood banks who are turning people away at the door based on XP or based on their appearance, saying appearance se pata chalta hai ki high risk hai. This is the concern. So obviously, if the NACO or National AIDS Control Organization had some sort of idea in mind, it has not trickled down to the actual blood camps. Shananzi, what can we do in terms of education? What can we do to help people understand different types of sexuality?
The more education, more awareness is required.
I think it's extremely important to have awareness programs.
More awareness through different media. Yours
Much
is the
more.
best media.
One second.
I think
Shaina, go ahead.
to me.
Shaina, go ahead.
Yes, Faye, I tend to agree that the best medium is obviously the media. But we need to talk, we need to be more vocal. I do concede that as a society we're very conservative, and India may or may not even be ready to approach homosexuality in the face. But the first step is like what Arun Jaitley ji says, where he says that we need to decriminalize because there are archaic laws of the 18th century that need to be done away with. After that you come to the next step, which is to accept, assimilate and respect. Now there are different communities, and that's why I said please don't refer to them as these people or this particular person. It is a community, and if that community's ideology you agree with or don't agree with is only one aspect of this debate. But taking it forward, if there is a risk element for choices of sexuality which need to be brought up through an awareness scheme, where people who even choose to have same sex choices must know of the complications that can arise by certain practices, and the certain practices that would make them absolutely safe and secure. I think that the government's role is not to sit on judgment of what two consenting adults do. NACO has only one area of concern, which is that there should not be a security risk.
I think what such language also does is we have to realize that we are already criminals in this country, by the way. We're already criminals in this country. We're already in a very peculiar situation where the Supreme Court is still to decide whether we are for equal citizens to others. What such language does is not just add insult to injury, it also makes it... It also makes it super difficult for us to even come confidently in front of
society.
When you have people like your Baba Ramdevs and all, who are the pseudoscientists, who know everything, who can cure cancer with a magic wand and everything. These are the people who we are fighting against. And then when you have a scientific body like National AIDS Control Organization using such loose language, using not the language that concentrates on behavior but on identity, it just muddles things up even more.
And makes the whole, it muddies the waters. It makes everything so much more difficult. If we are going to get more and more people in our country to understand, like Shaina said, to accept and to be able to talk about these things, we're not going to achieve that by putting out irresponsible communication like what has been put out by the NACO. Dr. Ravi Malik, go ahead.
May I just add one point, Faye?
Go ahead, Shaina.
Yeah, I just wanted to put up a point. I would like to take the discussion
Faye, I just
onto
want
a
to add
different
one-
practical orbit. You know, what happens is, who is going to disclose the personal sexual behavior, number one. Number two, how many partners, how many this thing. No one is going to, for that matter, disclose the personal information. Now, rather than depending upon the personal information, which is highly unreliable, probably people would not like to discuss their personal things. We should depend more upon the medical tests. We should do a proper double controlled blind studies. How many units are required in the country? How many units are available? How many number of people are...
All right, we seem to have lost that connection. I'm going to go back. Shaina wanted to make a point. Shaina, go ahead.
No, I just wanted to make a very limited point that we have to accept a few facts that we are hypocritical as a society. Look at the representation in parliament. How many people from how many political parties really want to even discuss homosexuality or the LGBT community? Very few, and very few would even show the guts to come up and even speak. Look at Shashi Tharoor's own acceptance in his party for his private members bill. There was none. So let's not sit on high judgment. I have to accept that India is a conservative society. There are different ideologies. We agree or don't agree, but we cannot just put blinkers on and believe that this does not exist. So the first step is accepting and respecting. The second step is to, of course, make sure that there is precautions, because safety and security of the patient is the only concern of the government or the health department or the health ministry. In the days to come, I'm sure technology will come up with lots of solutions to do away with any kind of HIV scare or probability.
So Shaina, while you did say that the government is in agreement that the archaic laws that criminalize gay sex or the LGBT community must be removed. We've also on this panel, the experts have told us that this entire assumption of high risk as a community is also archaic. The data that is being used to make this decision is archaic. The people making the decision are also archaic. And NACO, which is the National AIDS control body, is not a medical body. It's a bureaucratic body. So if we're saying we should rely on the medical opinions, let's rely on the medical opinions. We have 3 on the panel right now. We can source more. But the truth is, this is as archaic as any of the other laws in our country, because we're refusing to look at it. So, I respect everything you're saying, but my point is, this should be removed immediately. And if we're saying medical science will come up with new ways to test, we already have ways to test. They're available to us. I'm more curious to find out why we are not using them. And I want to go back to, if we have Dr. Ravi Malik, whenever we do have that connection, he said we must test, we must test. Are we not testing already? And if we are not, that is the bigger question to ask tonight. Sushant has just joined us. Sushant, where do you stand on this?
I respect all that Shaina has said. But, the first step is education, because we don't, you speak about acceptance and all of that, but, we are hardly educated about sexual practices, safe sex practices, where, once we start educating people about alternative orientation, some people don't want to believe it's a reality. So the the mindset of people is that, this is not a reality. And that is what we need to change. I mean, our education system, when we say sex loudly in a room, it's such a taboo. And why? I mean, if there's obviously someone having sex with one of the most populated countries, why not talk about it? This is the problem. This is the first basic problem.
We don't want to talk about it. I'm told we have Dr. Ravi Malik back again. Dr. Ravi Malik, you did say that we have to rely on science, we have to rely on tests, which I think is the unanimous agreement here on the panel. I want to understand, are we not doing that already? When you say we have to test and double test, why aren't we already double testing?
You can't double test. What is double testing?
No, we are already testing. That is not a question of. But what I am trying to tell you is that we should rely upon our tests more, rather than upon the history given by the patient about their personal sexual behavior. Because if we say that tests are unreliable to some extent when the patient is in window period, What I mean to say you is that we should
More
also see
advanced
the
form
larger
of test.
picture, that there are only two chances people getting the infection in 1 million of blood transfusion. What I mean to stress upon here is that we already have paucity of the blood. People are dying in remote areas because of the paucity of blood also. And secondly, we must do a larger study. How many units are required in the country, how many lives are lost because of this thing, and then taking a personal decision which should be based on the medical test. I'm not denying that. I know we do tests every day, as Shaina told me, that we know as a doctors that we are doing the test every day. But the thing is that we should rely upon these tests rather than discriminating on these issues.
Very well said.
I think the personal history of the patient can be reliable, but the tests are not likely to be unreliable.
So the most reliable, obviously, are the tests. Less reliable would be the personal history, and the least of all would be judging based on the appearance of the donor who has just walked through your door. We have Dr. Prasad who's on the phone line.
Today.
Yes. Go ahead, Anjali.
Just one sec. I really need to say this. Please. We do have tests which are more reliable. We have the PCR available. We must use it more. Why are we not doing PCRs? Why are we only doing antibody testing?
Yes.
So there is something available. Of course, it's more expensive, and that's why we're not doing it. But we need to do it.
It needs to be
subsidized. It's being done all over the world.
It does need
but
to be
in a
subsidized.
country like India, where is the budget?
Yeah, but it's being done all over the world. Let's do it here too, instead of blaming a whole community.
Realistic also when you give. Yes, but then
That's where the role of the government comes in.
Who is blaming whom? Please,
No.
I think that just to make it out to be as if the government has some.
No. So China. So you're right. In a country like India, we also need to examine instances.
Of the patient is.
No, but we've just established on this panel that the safety of the patient is in no way being safeguarded by discriminating against a community. We're achieving absolutely nothing. Testing is the only way to do it. Using sophisticated tests are the only way to do it. So I don't understand why we're still talking about the safety being a priority of the safety of the patient being a priority, because we're not serving that purpose.
I mean, we have money to build 3,000 crore statues. We have money to do all, and then states competing with each other to build a bigger statue than the last state. And the person's life is...
That is true. That's a tourist destination which gives livelihood, and that remuneration is going to be recovered by the state.
People won't be alive to have that livelihood if medical...
dying because medical...
Shaina, I've agreed with almost everything that you said until now.
This is a case where you're completely going out of.
No, but you brought up the budget. To be fair, it wasn't actually. To be fair, we were in agreement of the fact that safety of the patient should be priority. And then when Anjali pointed out that we have access to sophisticated testing, we have access to the medical tests that all of the doctors on the panel say we must rely on, which is the only reliable way to do it. You brought up budgets. You said, where are the budgets in India to do this? Immediately after, one of the medical professionals on the panel said that there are people dying for the paucity of blood. There isn't enough blood being donated in the country. There aren't enough tests being done. You brought up budgets. So I think that, to be fair, I think Deepak's rebuttal is a fair rebuttal, because there is money in our country. It's not like we don't have the money. It's about where we are prioritizing it.
Mumbai municipality is Asia's richest municipality. Asia's richest municipality. So, I mean, we need to have priorities. Do we need more tourist destination, or do we need more people alive?
On national level also, we're talking about the NACO. The same NACO have reduced the budget of HIV program by 30%.
Yes.
It's have make a difference to people who are in the program. There are lots of NGO who have been working on this group. The program has been withdrawn from them, and making the people more vulnerable,
susceptible to so many more diseases. That's
this, when you're talking about the budget, we are talking about budget of health. Instead of cutting down the health budget, we request you to please increase those budget and also subsidize the testing and mechanism on giving the more safe form of blood to the patients.
And we should also, while we're talking about this and we're talking about the responsibility, if we have Dr. Ravi Malik and if he can hear me, there are stories right now, Dr. Malik, that should also concern us about saline being mixed with blood in order to fill up a bottle that might be only half full. Of the fact that we're not able to preserve and properly transport blood to various parts of our country, and in a lot of cases, entire bottles of blood get thrown away because we've not managed to look after it and they're not fit anymore for transfusion. Is this true? Then Dr. Malik, if Dr. Malik can't hear me, any of the other doctors on the panel, Dr. Sanjeev Mehta, if you heard that question. Is it true that we waste a lot of blood in this country?
Very good points. First of all, the history is completely unreliable. We have to go to testing. We have to protect the blood we collect. We have to collect more blood through more awareness and education. I think it's a holistic approach, and you're completely correct in it. The amount of blood that gets wasted is not funny. After all the effort that you take, if it's not well protected, then it's a complete tragedy. A. B, as you rightly said, there's a lot of mismanagement of the blood, like you talked about. Of course, that does not happen to the best of my knowledge. But if blood is mishandled, that would be a complete disaster. It's a much wider discussion than just discriminating. I completely agree. There should be no discrimination at all.
All right. We have Dr. Prasad, who's on the phone line from Hyderabad. He's just called us. Our phone lines are open. Dr. Prasad, go ahead.
Yeah, I was just trying to draw a parallel between the present argument and in the 90s when there was a BSE crisis, bovine spongiform encephalitis crisis in the United States, in the United Kingdom. Many blood donors were turned away from the UK, from the United States, in Japan, and Australia and New Zealand, simply because they lived in the UK and they might have eaten British beef.
How is that the same thing, though?
So, similarly, there is nothing about discrimination. It is about public safety.
It's about what? It's not about discrimination. No, but you must understand this is not a one-time note for someone who might have travelled to a particular location on holiday and eaten something that might have given them a virus. You're talking about an entire community, and you must. I have to put this in because we've run out of time, and. Because we're so undereducated about this in our country, and we just randomly say gay or we randomly say LGBT, we group in so many people without understanding who we're talking about, what sort of behavior we're talking about. There is the lesbian community, the gay community, the bisexuals, the transsexuals, the asexuals, and now there is a plus sign for those we don't even know about. All of these people are being clubbed together because we don't understand them. And what the government or the representatives of the government in NACO have done is made everything worse. We should be doing the opposite. We should be helping people understand. We should be actually finding ways to talk to each other, to understand each other, to figure out that actually we're not that different, that we all fundamentally want the same thing. And if you're ever in an accident, you will all fundamentally need the same thing, which is blood. We cannot possibly be living in a country that says that an entire community is high risk and will be turned away at the door when they want to donate blood, when we know very obviously that we are desperately in need of donors. Perfectly healthy people don't donate. Why would you turn away someone who wants to donate? It's completely ridiculous. We have to relook at these things. They are as archaic as the rules that make being homosexual in this country completely illegal. In this year of 2017, let's relook at why we discriminate as much as we do. Let's find ways to understand each other, and this would be a good way to start. Thanks for watching.